Welcome to the Healthy Habits for Active Aging podcast with your hosts, physical therapists Dr. Michael Gorman and Dr. Lauren Bennett. This podcast will discuss a variety of health-related topics focused on educating the aging adult, allowing for an active lifestyle no matter the age. Don't forget to rate, subscribe, and share. Enjoy the show.
Hello, and welcome to another episode of the Healthy Habits for Active Aging podcast. I am your host, Dr. Lauren Bennett, and I'm a physical therapist out of St. Louis, Missouri. Today, we have a very special topic to talk about in an interview with Dr. Sam Cardona, and he's one of our very own iMove PT physical therapists out of St. Louis as well. So welcome, Sam, and we thank you for being here today.
Awesome. Happy to be here.
Yes. So we are going to be talking about blood flow restriction therapy. And I feel like this is a topic that has really taken off as of recently. But when I was doing some research, it actually dates back to 1966 out of Japan with Dr. Yoshiaki Sato. Is that correct, Sam? Do you know?
Yeah. It is correct. It's been a while.
Yeah, it's been a while, which I was surprised at. So, we'll let Sam talk more about it, but basically the concept is that we know that muscle weakness can stem from a variety of pathologies and conditions. And traditionally, when you think about lifting weights and getting stronger, you think about going to the gym and loading a muscle group with a lot of weight and increasing your resistance in your reps to make your muscles hypertrophy. But this concept has to do with occluding some blood flow, allowing the blood to go into the extremity and then not allowing it to come back up as well. And so Sam will get more into that, but less weight and less intense, but same effects. So without spoiling too much, I'm going to let Dr. Sam go ahead and introduce more about himself. How long have you been a PT? Where did you go to school? All that fun stuff. And then we will let us get into more about it. So.
Perfect. So let's see about myself. I've been a PT for almost 4 years now. I hit my 4-year anniversary in August. I went to school in a small school in southwestern Virginia called Emory and Henry College, just a place where I got in. The only special certification I actually have is BFR. I got trained in BFR. I think that was one of the first things I did when I graduated. I started working in October, and I think I got my certification in January. So,
okay, awesome.
Yeah. So, and then I used BFR pretty heavily with the job I had those first 2 years.
Okay. And was it something that you were very interested in, or was it something that the clinic you worked at just used a lot?
Oh, no, that was something I was really interested in. When I was a student, I went to the combined sections meeting 2017 and 2018, one of the years I was presenting. And so I already knew about BFR, so I went to some conferences for BFR both of those years to just listen to what people were doing. A lot of good information there. So even then it was pretty widespread 4 or 5 years ago.
Okay. Yeah. I know that my clinic, we used it a little bit, but I would say nobody specialized in it enough to really use it confidently. But now definitely, I know that our company offers it. We'll get into more about that later, but it's not too bad. So we'll get into more about what you use, but first let's go over what exactly is it? Let's go more in depth about that. What is blood flow restriction training? Because the name of it, I'm not going to lie, sounds kind of intense.
Right. It definitely does sound intense. And when you're doing it, it is intense. But basically, as you kind of talked about earlier, you're using a cuff on an extremity as close proximally as you can to occlude a certain amount of blood flow. The amount depends on which type of bands you're using. So that way that blood pools in the extremity. And so then as you do that, you start to deprive your muscles of oxygen, and you reach that muscle failure point a lot faster than you would under traditional training methods.
So you would obviously train this muscle group with less weight than if you didn't have the cuff on it, right? Because the exercise seems a lot more intense and harder than normal.
Yeah, you typically, at least in my training protocols that I've done, about 20 to 30% of your 1 rep max is all you're using.
Okay.
And that's more than enough. You fail out really fast.
Yeah, I think I tried it on myself. I'm sure you've done it way more than I have. But we were doing very simple exercises. I mean, it's
Mhm.
something like, I know that they have like the legit ones, the new occlude, and it's like looks basically like a blood pressure cuff, correct?
Well,
Very
yeah.
similar to
And
it.
yeah, if you get like the Delphi system, for example, is the one you see a lot of if you're looking at professional athletes or something, if you've seen
Okay.
videos of that. And it's like attached to an IV pole with a blood pressure. It looks a lot like a blood pressure cuff on one limb.
Yeah.
And yeah, but that's a good idea of it.
Yeah, so I think we were doing like squats or leg press or just like straight leg raises, and like it fatigues
Mhm.
quick. So you really don't have to do a lot of weight or a lot of reps with this, but it's really cool to get the same effect. So I think that there's less, let's say, stress on the ligaments and the tendons, and prevents loss of muscle mass in people that are immobile. So I think the concept of it is that it's tricking your body to think that it's working harder than it actually is. So would you agree with
Right.
that?
I
Okay.
mean, it's not really a trick, right? Because you are working hard, right?
Yeah.
Your muscles are being deprived of oxygen, like they're in the anaerobic state where they're stressing. So you're working hard, but you're achieving it a lot faster. And some of the benefits that you just mentioned, like if you have an injury, like your ACL recovery or whatever, and you can't load a joint, so you can't afford to stress a tendon or anything like that, you still want to be able to maintain that muscle mass. So it's a really good way to work muscles without stressing joints or tendons.
Yeah. So the populations that you have treated this with, I know you just mentioned ACL or any post-op or people that are immobile. Are there other populations that you would say would be a great candidate for BFR?
Yeah, pretty much any group where you can't stress a joint. So ankle sprains, ACLs is the common example. because I used a lot of it for ACLs. Even people who just have problems loading a joint in general, like if they had knee arthritis or something like that, and you really want to help strengthen the muscle, and you're doing, maybe you're forced to do open chain exercises because they can't tolerate a squat or something like that, and there's only, and they're straight leg raises. You don't want to put a 20-pound ankle weight on
Okay.
their limb. Then it's really good for those populations where you don't, either they can't tolerate stressing a joint, or they, it's against a protocol to stress the joint.
Right. Okay, so I'm going to give you the opposite. Are there any populations that you would not want to use BFR with?
Um, Definitely, of course, all the contraindications. So if you have, active wounds, active cancer, pregnancy,
Okay.
blood clotting issues like a DVT or something like that, I definitely don't want to use it for them. I would say also like a general, like if you're completely healthy, if you have no issues at all, you're able to stress a joint, you're able to load a joint, then if they wanted to try it, I mean, it's not like it's contraindicated, but I would definitely try to steer them towards just lift heavy instead
Okay.
of trying to use PSR. Yeah, just lift heavy, because you do want to, if you're healthy, you do want to stress your ligaments and your tendons and stuff like that, so they can get stronger as well. So that way, if you go and they, I don't know, if they're a weekend warrior, if they're any athlete or something, that those
Mhm.
ligaments don't just break when they go to put them into high stress situations.
Okay. Yeah. So, just for our audience, I think that it's important to go over like how does muscle growth happen? So, I know that like there's three big topics, but first of all, I know that this is the one that I usually feel when I go to the gym and you do enough resistance or enough reps and you feel that good muscle soreness the next day and you're creating that actual muscle trauma, which is creating some micro tears in your muscle fibers, and then blood flow gets in there and hypertrophies it, and that's how your muscle gets stronger. But another one is oxygen depletion. So your body needs more oxygen when you're lifting heavy weights. And because of this increased demand, there's less oxygen available to the muscles. So with less oxygen to the muscles, your body creates these lactic acids to stimulate muscle hypertrophy. So I think that that's a big concept of the BFR. And then the cellular swelling, so blood flow increases when you exercise, and then more blood flow to the muscles causes them to swell and lead to growth. And I think is another big concept of BFR. So I think that's kind of how this originated and the purpose of it, which is pretty much right on task. So let's just say that with our populations, we went over who it's good for, who should not really use it, and who it would be contraindicated for. But what if I'm just an avid gym goer? I don't want to spend like a couple $100s. I mean, what are these big, like the big brands? They're a couple $100s, right?
Absolutely. I think if you wanted to get, for B Strong specifically, if you wanted to get a band for each limb, so 4 bands, I think it's like, it used to be, I don't know how everything priced is now. Things got a little crazy, but it used to be like somewhere between $500 and $800.
Wow.
So yeah, and I know with the company I worked for before, they got discounts because they were buying like 1 or 2 packs for every single clinic.
Okay.
But if you're just like a regular person trying to buy these bands, they are pretty expensive if you want to get the legit ones. Even me personally, I've seen guys at the gym I go to, sometimes people just take like a TheraBand and wrap it around your arm to try to get the same effect. I wouldn't recommend that because it can lead to some problems.
Yeah, I was going to say, I have definitely seen some people at gym working out like that. And I'm like, I think that they make those so that way they're not going to be as intense, so you can like completely occlude your extremity. Because I think they are made to be a little bit looser since they're not accurate, but you just have no objective measurement to know, at what pressure you are occluding your arteries and veins. And so,
Right.
yeah, so we would definitely recommend. I think the gold standard is to like use a Doppler, and I'm sure not too many clinics have that, although ours will at iMove PT. But a lot of clinics I'll see, I think we just used to take a blood pressure of the extremity, and then, like you said, take a percentage of that. Is that how you did it, or how did your clinic do it?
Yeah, so with B Strong, you don't actually have to use a Doppler because you're not reaching 100% occlusion, which is what you would use that Doppler for. Is you want to stop hearing the
Okay.
blood go through the limb. So depending on the size of the person and how intense you wanted it, they had like kind of guideline recommendations of how much pressure you wanted to inflate the cuff to, depending on which limb it was. And then you kind of there. A lot of it was based off of the patient's discomfort. So you want it to be like mildly uncomfortable because it's, you have a band that's stopping some blood flow from going into the limb. It's not supposed to be good, but you don't want any pain. So once they, and usually I would kind of slowly ramp it up over the course of a couple of sessions. You start at the general guideline, you do a whole workout session, you see how they do. And then if they were like, yeah, that was pretty easy, you're like, all right, so the next time I'm going to increase by another 50 millimeters of mercury, depending on, if it's an arm or a leg. With arms, you don't need to go up that high at all.
Right.
With legs, there's a lot more meat there, so you get a little bit more like.
So how long, like how many exercises are you having your patient do? And how long is a typical treatment of BFR if you have this like cuff occluding your blood flow?
It depends on the person and kind of what protocol you're using. I know when I was taught B Strong, the protocol is like you use it for about 20 minutes for whatever you're trying to do, then take off the pressure for like a minute and then kind of get back into it. I had some athletic trainers I was working with and some other therapists that if the patient was fine and they weren't complaining of discomfort or anything like that, we'd go through probably a whole workout session. So it'd be about 40 minutes. I've left it on people for that long. Every once in a while, the cuff would lose a little pressure. So sometimes just the nature of what they're doing, they're moving their arms, they're moving their legs. You take the cuff off and you reinflate it. So you get that kind of minute break kind of built into the workout anyway. But yeah, I've done about, I think, 40, 45 minutes, probably the longest I've ever done. And I've done that on myself about 40 to 45 minutes too.
Okay. Yeah, I was going to say.
Yeah.
Yeah.
When I was first trained, the athletic trainer who was training all of us, because when I got certified, he put it on us for like an hour and a half. So he made us do like a whole hour and a half of workout because he wanted us to feel kind of what the point feels like when you're doing BFR.
Yeah, I think that's so important when you have something new, or I mean, it's not necessarily new, but just something that you're going to use with your patients, that make sure that you've done it on yourself so you know what they're feeling. That would be my first question if I had a therapist about to do it on me.
Yeah.
But yeah, I've had it done. Yeah, it's really neat because you can do like the simplest exercise and feel like you just had this massive workout. But like if you're using these and it's guided, I would totally recommend, if you're interested in this, make sure that you're a good candidate for it first. Like talk to a healthcare professional or a physical therapist in particular, if they're make sure they're trained on it so they know like how to occlude it. That's probably the safest way to go about it. I would not just first time go buy something and try it yourself, because people do have contraindications to this. You know, if you have a bone fracture, we went over some of them, but you know, fracture, blood clotting disorder probably is most common. People can bruise with this. We just want to make sure you're going about this as safe as possible and that you know all the benefits. I don't know, Sam, are there too many risks with this other than, I guess, if you were to damage something by occluding too much, if you didn't know what you were doing, what would you think? What do
Yeah,
you see?
if you're using some of the bands that you can just buy online, most of the time you'd have to kind of go out of your way to hurt yourself. Some of the bands that aren't B strong, they're like pretty much just glorified mattress straps, right? And so you can, if you're just tightening it up as much as you can get 100% occlusion with some of these. The risks of that is that you can damage nerves, especially in the arms, because there's just not a lot of meat there. The nerves are pretty superficial. So that was one of the issues with that. If you're just getting some like random bands off the street, the B strong bands specifically, it's pretty hard to damage something.
Okay.
Yeah, so that they're pretty safe, but at the same time, you still, if you have no medical knowledge, if you're just a random person, all right, I would read up on this and really make sure that this is good for you. Like this is the direction you really want to go. And the easiest way to do that is to talk to a healthcare professional, a physical therapist, somebody who's trained to be far, and they can kind of guide you through everything.
Yeah, I agree with that. Just especially if it's your first time, they'll guide you. Hopefully you can learn and then you can continue to do it on your own. So I did mention a little bit earlier, iMove PT, we do use BFR. We have certification, some of our therapists in that, and we do use the Doppler ultrasound with that. So if you are in the area and interested, as always, with any questions, like reach out, info@imovephysicaltherapy.com. But we can answer any questions, get you set up with that, and tell if you're a good candidate or not. So there's my little plug there. So we did talk about, Dr. Sam, you did do this on your own. So before we leave our listeners today, would you give them any advice or last comments about BFR?
If you are an avid gym goer and you have an injury of some sort and you still want to maintain muscle mass, and you don't have any of the other contraindications, BFR is probably a good way for you to maintain your mass while you're through that injury and recovery process. If you are completely healthy, or if you're new at the gym, right, just learn on proper technique and lifting heavy. Don't worry about BFR bands. It is exciting to get to, like, oh, wow, I only have to work half as long. I can still achieve some muscle gains, but it is better just to lift heavy rather than kind of going through this. And don't buy mattress straps and put them on your arms.
Yeah, I was reading somewhere too. It can be a good alternative to people that are big gym goers, like to switch it up, do like your lift heavy days, a few days, and then like on your, not necessarily your rest day, but what do they call it, your active rest day, to do BFR instead. So you just give the ligaments and the tendons and the joints kind of a break. And then before you get back into your normal routine of lifting heavy, because that's always fun. So,
and that's definitely fun. Those dudes, usually, if you're doing that, you're already a pretty big expert in the gym. Probably been lifting for a couple of years. Hopefully, you know what you're doing.
Right. Okay, well, thank you so much for coming on with us today, Sam. We really appreciate your knowledge and your experience with BFR, because I do know that we will have some listeners that are interested in this, if you've heard of it or you haven't heard of it. But like I said, any further questions should go to info@imovephysicaltherapy.com. Sam or I would be very happy to get back to you, answer any of your questions, and lead you in the right direction. So we will see you, or I will see you, Sam, on that in 2 weeks for our next podcast, which is still to be determined on the topic. But if you have any suggestions or want to hear anything in particular from us, please email us. So have a great week. Thank you, Sam.
Thank you so much for having me.
We hope you've enjoyed this episode of the Healthy Habits for Active Aging podcast. If you have any questions for Dr. Gorman or Dr. Bennett, please send an email to info@imovephysicaltherapy.com. To learn more about healthy aging, visit our website at imovephysicaltherapy.com. Like what you hear? Be sure to rate and subscribe. See you next week.